now I want to introduce Dr. Joseph Scherger, who is our special pre-lunch lecturer. I've known him for a long time, and he is a long-standing board member for California Prostate Cancer Coalition. In all the prostate cancer conferences and meetings that I've ever been to, they have never, ever had a primary care provider talk about the role of the primary care provider in prostate cancer. So we're really thrilled today to have him address that subject. He is an outstanding family physician at the Eisenhower Health Center in La Quinta, which is near Palm Springs, for those of you not familiar with Southern California. An MD, MPH. He's faculty for the Eisenhower Family Medicine Residency Program and a clinical professor at USC's Keck School of Medicine in Los Angeles. Also, he has a special interest in nutrition and healthy lifestyle living, so that ties in with the rest of our afternoon as well. And a very detailed bio of Dr. Scherger appears in our Prostate Cancer Conference brochure. And by the way, the agenda is in this brochure. I heard some of you asking where the agenda is. A long, detailed bio of Dr. Scherger is in there. So I urge you all to read it. And he has given over 1,100 special invited presentations. Today will be over 1,101. And I'd like you all to thank Dr. Scherger for his special pre-lunch lecture.
Well, thank you, Meryl. It's a tremendous honor for me to be here. I have learned a ton this morning. What a privilege, and very impressed work. So I congratulate all of the speakers. I'm going to get you to lunch on time, I promise. Because I can condense what I think are the most important things I'd like to say. First of all, I hope all of you have a personal primary care physician. I hope it's someone who is your, not only a person who can coordinate your care, treat all your common health problems, be a health coach and an advisor as you navigate the complicated healthcare system. There were so many times this morning where I heard patient preference, and I'm just imagining most patients who haven't gone to medical school sitting there with these deep knowledge experts who all have different tools in their tool house to offer you. And how do you make that kind of a decision by yourself or with your family? And it's very, very frightening. And I think your personal primary care physician, not a deep knowledge expert by any means, but someone that you can bounce it off of and I think do a much better job coming to a decision. Now, you want to know your primary care physicians. They don't all come the same way. First of all, make sure your primary care physician is supportive of diagnosing breast cancer or prostate cancer. Believe it or not, in the world of primary care, there's been this backlash against even diagnosing prostate cancer. There's the old common saying, you don't die of prostate cancer, you die with prostate cancer. And of course, there is some truth to such a statement, but it's not a statement of health when you've got 30,000 Americans, men, dying every year of prostate cancer. That is a condition to be taken seriously. But you have to sort it out, because we diagnose almost 200,000 men with prostate cancer every year. So it is a complicated thing to sort out where you're at, your overall health otherwise, what's your life expectancy with respect to cardiac disease and other factors will all go into your decision. I was impressed with the clear delineation of active surveillance for 3+3 Gleason prostate cancer as the right way to go. And so use your primary care physician. The primary care physician will also coordinate other aspects of your care. When you have prostate cancer, it's not like the rest of your body goes on hold. You need a primary care physician to work with while you work with your prostate cancer treatment team. Besides that, I just wanted to say that getting prostate cancer is a wake-up call to taking your overall health seriously. Prostate cancer is one of the 12 cancers that have been clearly identified with overweight and obesity, and that's an epidemic. There's a very smart Harvard oncology when he was a fellow, Siddhartha Mukherjee, who about 9 years ago wrote an entire biography of cancer called The Emperor of All Maladies. And he traced in that tremendous book, which was turned into a series on PBS, that cancer actually used to be kind of rare. It was not a dominant form of disease like it is now. It is increasing, and it's not increasing because our genetics have changed. It is increasing because we have a cancer-generating lifestyle. And getting over cancer, beating cancer, isn't just staying the same and throwing your lot with these tremendous combination therapists. You want to do your part. June Chen's talk may be the most important talk you're going to hear this afternoon about what you can do to become healthier. Because if you're going to beat cancer, you need to eat right. You need to realize that sugar feeds cancer. There are nutritional methods of starving cancer. A Harvard Dr. William Lee, it's spelled L-I, just published a book called Eat to Beat Disease, going over more than 200 food products that you can use to strengthen 5 of your defense systems that help you beat disease, including cancer. So besides going along with all these important therapies, and it isn't a matter of, okay, I'm not going to get cancer treatment, I'm just going to do healthy lifestyle. Well, that's a foolish decision. Very nice study in the last year showed that people who did not want to be treated for their cancer and just use healthy lifestyle died at twice the rate of people who were willing to undergo good treatment. So it's a combination. But do your part. I was observing that it appeared to me that every one of our speakers this morning looked pretty healthy. It looked pretty lean. Okay? There's a message there. I think they know something. Take good care of yourself. Work with your primary care physician. I can imagine that if you've been diagnosed with prostate cancer and you're plugged in to a treatment program, one of the things you can do with your primary care physician is say, get me healthy. What can I do to improve my own health so I can increase my chances to beat this disease? So having said that, I'm going to send you off to a healthy lunch. Thank you for having me.
Not quite yet.